Thank you very much for joining us in our YouTube channel, Dr. Nader Hamada. And we will start discussing today one of the most important topics in vascular surgery, which is peripheral vascular disease, or the other term is peripheral arterial disease. Just we need to get a small background from the pathology. As you understand, the peripheral arterial disease is a bed affected in a bigger prospect of disease, which is atherosclerosis. Atherosclerosis is the disease that affects the medium-sized arteries in the body, and it can affect different beds to different extents. And this is, you should be minded by having the atherosclerotic process in the body of the patient when he is presented to you with one of the symptoms, and if you find one of the signs of atherosclerosis. So if someone comes to you with peripheral vascular disease, you have to remember that this patient is suffering usually from atherosclerosis in all his vessels, regardless if he has a history of other beds affected or not. So you have to focus on these other beds and ask about them, and if there is any intervention needed for this patient, he should be aware that he is liable for complications related to other beds that could be affected by atherosclerosis. And just a reminder, the peripheral arterial disease is atherosclerotic process that will occur in the upper limb or the lower limb. It can affect the coronaries, and usually the patient will be presented by either ischemic heart disease or acute coronary syndrome. It might affect the cerebral and carotid and vertebral vessels, and the patient might be presented with cerebrovascular accident, transient ischemic attacks, or central retinal artery occlusion, amaurosis fugax. All of these are presentation from the cerebral and retinal circulation. The patient might, if he's a male patient, he might be presented with impotence if the atherosclerotic process affected the aorta, the common iliac, or the internal iliac arteries. And if the patient has renal artery stenosis because of atherosclerotic process, he might be presented with secondary hypertension. The patients who will get significant atherosclerosis in more than one artery in the mesenteric circulation might be presented with chronic mesenteric ischemia. We'll discuss most of these topics in other videos, but I just want you to be aware that the patient who has atherosclerosis and he has symptoms or signs of peripheral arterial disease, that you have to ask him about the other beds affected, and be aware that these beds might be affected if you will do any intervention for him. So the first question that might come to your mind, if the peripheral arterial disease is occurring in upper limbs and lower limbs, so why do we see patients complaining more of the lower limbs? There are different reasons. The first thing actually, that the upper limb is closer to the heart, so the blood has to travel a shorter distance. The second thing, that the collateral circulation of the upper limb in comparison to the muscle bulk of the shoulder, the forearm, the arm, is actually better than the collateral circulation in comparison to the muscle bulk of the lower limb, which has a bigger muscle bulk. And the third thing actually, that even if the patient has a very sedentary lifestyle, he still is using his hands most of times. He should eat, he will wash himself, he will brush his teeth, he will type, he will just write something, he will use his phone, he will use the remote control. So actually, even if you have sedentary life, you are using your hand in a regular exercise, and exercises are very, very important for collateral development. And just to simplify the collateral circulation, if you look at this drawing, so usually if point X is getting double blood supply from two branches from this artery, the blood actually is flowing from one point to another in circulation just by pressure gradient. The blood doesn't understand that this is an artery and this is a vein, it's just a pressure gradient. So when the blood is flowing, it flows from proximal to distal just because the pressure gradient proximally is higher than distally. While actually when it flows to the tissues in the artery, it flows because the arterial pressure is higher than the tissue pressure or the capillary pressure. So this is normally what happens in the normal circulation. So the patient will have this X area which is getting double blood supply from two arteries from the arterial tree, and the blood will flow in this direction and that direction because the pressure here is higher than point X. If the patient gets atherosclerotic process that causes plaque formation, that causes significant stenosis or occlusion of the artery here, the pressure here will not be affected proximally, but obviously the pressure distally will drop significantly. And when the pressure drops significantly, we reach a point that the pressure in point X is higher than the pressure in the artery distally, then the blood will flow to point X from proximal, and then it will flow from point X to distal like a natural bypass. And this is the whole idea of collaterals. And if you understand this idea, you will understand why patients with chronic ischemia will have gradual onset of symptoms, while the patient who will have acute ischemia, if something comes and just to block the artery here, the patient will not have time to develop these collaterals, and then he will have more profound and significant symptoms. This is the first video about peripheral vascular disease. Follow us on the channel and we will continue telling you more about history taking and examination about different vascular surgery topics.